Hello, this is Harry Hobson, President and CEO of Plymouth Harbor, and I'm calling in remotely to my partner, Karen Novak. Karen is as you know, our administrator of strategic healthcare initiatives and really our point person for all of our infection control matters. Good morning, Karen.
Good morning, Harry. It's nice to see you. We are
Well,
a busy state.
oh my gosh, this is very busy state. I know we're going to talk about that. I was just looking at the newspaper and I see that just since yesterday, we've had something like 3,800, a little over 3,800 new confirmed cases of COVID-19.
Absolutely. And we've had 8,000 cases since the beginning of this week, with the age trending down into the mid 30s. So it's eye opening. And as I shared with you earlier, the hairs on the back of my neck are starting to stand up, and it's time for us to really pay attention to what's going on there.
And we're going to have to address that here this morning. Karen, as I mentioned to you offline earlier, I had received an email from an official over at Sarasota Memorial Hospital today. And again, it's kind of a gut check, if you will. What I was told was that if you look at a week ago at Sarasota Memorial, there were 8 confirmed cases of COVID in-house at the hospital. They had 0 on ventilators and 0 in the intensive care unit. As of today, that number has gone from 8 to 23 in-house, and now they have 5 patients on ventilators and 5 in ICU. So it's definitely trending up again. And it was also confirmed with what you just said, and that is that the numbers is trending down as far as the age group is concerned.
And that's
What
kind of
concerns
great.
me about what concerns me about that is we're certainly not out of the woods by any means regarding our resident population. But when you look at the average ages you just mentioned, I've got concerns about the visitation because younger people are beginning to come and visit. So we're going to have to deal with that this morning.
Yes, and it's concerning too with that age dropping. We think of our young adults as being able to really fight off just about everything and anything, but it just shows how intense that virus really is. It is a deadly virus, and it's on the resurgence right now here in Florida.
It really is. It really is. And, I'm constantly asked about testing. And I know we all spent quite a bit of time with our state association and beyond yesterday and even the day before about some of the testing from staff. Can you give us just kind of a little bit of an update, what we got out of the last 24 hours?
Sure. Let me just do a real quick test. I'll catch up on what's happening here at Plymouth Harbor with our COVID. We still have one staff member who is now on her second test. We're expecting a negative to come back from that. And then we'll do a third test on her, and I'm sure she'll be cleared without any difficulties. We had 2 residents that are asymptomatic, but had some adventures in the emergency room, so we had to bring them back and swab them. They are in our COVID unit. We're just kind of keeping an eye on them until we get our testing back. But speaking of testing, like Harry, you did say, we've been on the telephone with the Department of Health, the Emergency Management, the Secretary of CMS, ACA, Mary Mayhew, as well as the Surgeon General for the state of Florida. We are going to begin testing on July 6th. We're going to be testing every 2 weeks for at least 90 days, all staff members here at Plymouth Harbor. And it's going to be quite an initiative to get done. But you know what? Our priority is still keeping that safe environment for the residents and the staff. So it's going to keep us on our toes for the next few months, but something that is well worth doing, especially since we're seeing these numbers rise in that age population. So we're looking forward to it. We got this. We can do this.
Yeah, absolutely. Absolutely. Well, Karen, there's 2 specific things we want to talk about. this morning, and it's going to be a change. So let's go right to it. Let's talk about masks. And the fact is that when the numbers that we're looking at right now increasing, we're going to move forward with a policy that everyone, both residents and team members, must wear a mask anytime they are outside of their apartments or they're away from their workstations, if you will.
Absolutely. Today alone, I think I've had 3 phone calls that I've really had to make to encourage and remind our residents to put on those masks. I think the data will show and support that when you wear a mask, your chance of acquiring this deadly virus diminishes greatly. And when you and somebody else have a mask on, that's like less than 2% of a chance that you might get something. And that is by far the greatest number that we really want to see, other than 0. But wearing that mask at all times is so very important, in addition to keeping that social distance, that physical distance of 6 feet.
It really is. And it's interesting because we'll be putting out a splash today talking about masks and also visitations in a few moments. But on the reverse side of that splash, we're going to print something of great interest. For example, if a COVID-19 carrier, does not wear a mask and comes in contact with another person, there is a 70% probability that that person will get infected. And that person who is on the receiving end, COVID person, no mask, they're talking to someone even with a mask, 70% chance of getting COVID. Reverse of that, if the COVID infected person has a face covering, if you will, comes in contact with someone that does not have a mask on or a face covering, there's a 5% probability that they will transmit that virus. And if both the person who's the carrier, the infected person, comes in contact with someone that is not, there is a 1.5% probability of transmitting that virus. So again, as you've said many times, we both said it, everything we try to present to our residents is evidence-based, and as is this. So we'll be printing this a document today on the reverse side of our splash, and it basically is what I just said.
Absolutely. You are your keeper of your gate and your body. And personally, I don't think that's something I want to take home or acquire here at Plymouth Harbor. And I am sure residents and staff have that same feeling. So please don your masks. If you do not have a mask, please come up to home care. We will have a supply here that you definitely can have. So please ask for them.
Okay, very good. Very good. Karen, now we need to move on to visitation. And as I think everybody will recall, about 2, maybe 3 weeks ago now, we went into phase 1 of visitation. And what that was, where we opened the campus, exterior campus, to visitors. So our residents, and now I'm speaking independent living only, where our residents could go outside of the buildings and meet with their visitor, their guest, whatever. And then that was successful. So 1 week later, we made the decision to go into phase 2. Phase 2 allowed those guests to go through screening and then come into the buildings and then visit with the residents. And as you pointed out many times, and I've looked at the statistics all week, oftentimes those visitors are those personal assistants, if you will. It's
Right.
not just family members. So Karen, you and I have gone back and forth all week wrestling with this, and I think we've come to the conclusion today that we're going to take a step back. We're going to take a step back from phase 2 back to phase 1. So what that means is that we're only going to allow visitors or guests to come onto the grounds, and our residents, again, independent living, would have to go to an exterior location on our campus to meet with them. Again, we have chairs set up in the pool areas around the campus to accomplish this. When we conclude this call today, I'm going to get in contact with George McGonigal and Marty Martell from facilities and ask them in the next day or two if they could rent some of those shade tents, okay, and have some of those placed around the campus with some of our chairs that we have in storage right now. So bottom line is we are going to take a step back. We hate to do that, but on the other hand, we are doing it for the health and welfare of all of our residents and team members.
Absolutely. You know, that paradigm has started to shift, unfortunately, to the negative, and it's really our responsibility to make sure that we have a safe environment. And it does cause us great angst to really have to do this, but we know it's the right thing.
It really is. It really is. You know, let's look on the bright side. We are doing so well across this campus, and all you have to do is look at the media, look at the newspapers, not only here in Sarasota but across the country, and you can see how well our residents and team members are doing, and it's being done because they're supporting us, they're cooperating, as are their families. So that's why we're doing this. Let's take a step back to phase one. That doesn't impact the wellness program activities at all. I've had a conversation with Tina and Summer, so don't worry about that. But it does our internal visitations.
Yeah, it brings that risk of exposure down to a better, more manageable kind of initiative right now.
Absolutely, absolutely. Karen, looking at my list here, I think I've covered most of the items I wanted to. Is there anything else you wanted to add?
Absolutely. We're going to close it out just like we always do. We want to remind you, please, to wear your masks at all time. We want you to keep that social distancing of 6 foot. We want you to wash your hands quite often. We're going to have hand sanitizers. We'll get those outside now that we're going to open up just to external visitors. So expect to see those hand sanitizers out there for your use. Please remember to hit those high contact areas quite frequently. But really, again, it comes down to wearing your mask and keeping everybody safe. It truly, really is important that we protect each other and respect each other and have those masks on when we're out in the common areas as well as when we get off site. So please, don your masks.
Absolutely. Thank you, Karen, again for that reminder. And actually, this video is over, so it's time to don our masks.